Room check. Nothing on the curtains. Nothing over here. Whiteboard. Tongue depressor. My name is Tori. I'll be recording for Arika today.
Hi, I'm Arika. Knock, knock. I'm gonna do hand hygiene. Hi, sir. How are you? My name's Arika. I'm a student nurse here at Moraine Valley. I was wondering if it would be okay if I did a quick physical assessment on you. Patient gives me consent. Awesome. Provide for privacy. All right. Before I begin, can you please tell me your name and date of birth? Patient states name and date of birth. I verify it with his ankle band. It is correct. I'm also going to check to see what his A&O is, so his alert and orientation. Sir, can you tell me where you are right now? Do you know why you're here? Do you know what month it is? And what holiday is coming up? Awesome. Since patient stated that his name and date of birth, and it's correct, and then he stated all this was correct, his A&O is ×4. Wonderful. His speech is clear. He's willing and able to speak to me. As I'm looking at him, I could tell that he is not distressed. He is calm. He is well groomed. It looks like he combed his hair. Looks like he's fresh out the shower. Teeth are brushed. His gown is new. It's clean. And yeah, now I'm gonna start my assessment. So I'm gonna do a full set of vital signs on him. They're all within normal limits. I'm gonna raise the bed up to a working level so I don't break my back. As I'm doing this, I'm also gonna lower this so I can get a little bit closer to my patient. As I'm here, I'm going to start by inspecting. I'm gonna inspect the head. I'm gonna look to see if the head is symmetrical on both sides. I don't see any like indentations or protrusions. I don't see any little critters running around, so I wouldn't touch that. Anyway, I'm gonna look at the face. I'm gonna see that the face is symmetrical. There's no drooping on either side. The color is appropriate for my patient's ethnicity and race. There's no pallor, there's no cyanosis, there's no jaundice, which is great. The texture is good. I don't see any dry spots. I don't see any excessive oiliness, any like excessive abrasions or anything like that, which is great. What I'm gonna do next is I'm going to inspect the neck. The neck is symmetrical. The shoulders are even. I'm gonna look at the trachea and the substernal notch. It's midline with the body. Fabulous. After I've done that, I'm going to next palpate. So I'm gonna start back at the head. I'm gonna palpate. I'm gonna ask the patient if there's any tenderness. I'm gonna feel for any masses. I'm gonna look in between the hair. Again, no abrasion, no nothing like that. No bugs. I'm gonna also kind of feel through the hair. It's not falling out as I'm pulling at it. The hair is not too brittle. It's not too dry, which is great. Next, I'm going to palpate the lymph nodes. So I'm gonna start at the preauricular, which is right here, preauricular. I'm gonna palpate the postauricular, the occipital, then the back of the neck, the anterior cervical, the front of the neck, the posterior cervical, the tonsillar, submandibular, submental, and the supraclavicular. They're not swollen, so that's good. After I've done that, I'm going to inspect the eyes. So, pen light. I'm gonna look at the eyebrows. They're even and they're not sparse. Same goes with the eyelashes. They're all present, they're not sparse, they're all there. I'm gonna then look more closely into the actual eye. I'm gonna look at the sclera, it's white. Good, no jaundice, nothing like that. I'm gonna pull down on the eyelid. I'm gonna look at the conjunctiva. It's pink and moist, so that's good. There's no lacrimal drainage bilaterally on either side. The eyelids aren't drooping, so that's good. Next, I'm gonna perform Perla. So I'm gonna shine a light into the patient's left eye and look at it. It should constrict. I'm gonna shine the light back on the left side, but I'm gonna look at the right eye. I'm going to switch. I'm going to shine the light in the right eye, looking at it. Shine the light in the right eye, looking at the left. Great. Now I'm going to ask the patient to look at the ceiling. Okay, now look at my pen. Great. Now don't move your head, follow my pen, okay? We're going to move close. Very good. Now I'm going to move up, down, side, side, diagonal, diagonal. Awesome. Blink a couple times for me. Great. My patient's eyes are equal, round, and reactive to light and accommodation, and he has good eye muscle coordination. After I've done that, I'm going to move on to the ears. Okay, so I'm going to look at them on both sides. I'm going to assess to see if there's any lesions or drainage. There's none. I'm going to palpate the lobe, the auricle, and the tragus. Does that hurt at all? Any tenderness or anything like that? None? Great. There's no masses. I'm going to do that on both sides. While I'm at the ears, I'm also going to perform a whisper test. So I'm going to have the patient cover up the side of the ear that I'm not on. So in this case, the left ear. And then on this side, I'm going to whisper red, orange, yellow. I'm going to have the patient repeat it back to me. I'm going to do that on both sides. He answers correctly. He could hear just fine. Now I'm going to move on to the nose. I'm going to look inside the nose. I'm going to look at the mucosa. The mucosa is pink and moist. The septum is not deviated. I'm going to check for patency. He is able to breathe through both nostrils. There's no flaring, which is wonderful. I'm going to move on to the lips. I'm going to look at the lips. The lips are an appropriate color for my patient's race and ethnicity. There's no dryness. There's no cracking. No blisters. I'm going to have the patient open up their mouth, and with my tongue depressor, I'm going to tell them, can you please stick your tongue out? They're going to stick their tongue out, and I'm going to gag them. Checking their gag reflex, it's intact, which is good. I'm checking all their cranial muscles or cranial nerves. After I've done that, I'm going to look at the back of the throat. I'm going to look at the uvula. It is pink and inline. The tonsils are all they're present. They're not inflamed, and I don't see any tonsil stones. I'm going to look at the buccal and the sublingual membrane, mucosal membranes. They're pink and moist, which is great. Next, I'm going to have the patient smile, look at all their teeth. Okay, great. Then I'm going to pull down. I'm going to look at the gums. They are moist and pink. They're not receding or bleeding. All their teeth are present. They don't have dentures. No decaying, which is great. After I've done that, I'm going to be able to move down and now inspect their respiratory. So, as I stated earlier, my patient is able to breathe through their nose, and they are a nose breather, which is great. Next, I'm going to look at accessory muscles usage. There's none. There's no retractions, which is great. I'm going to inspect the chest to see for symmetry. It looks like both sides are moving equally. I don't see any visible pulsations. I don't see any abrasions, anything like that. No masses, which is great. I'm going to ask the patient if he's able to breathe well. Now I'm going to assess his breathing through a couple positions. We're going to start at a supine position, fully flat, pretend like my patient is flat. And I'm going to ask, are you able to breathe? He's able to with ease. At this point, I'm also going to assess his jugular vein distension, okay? So I'm going to be looking right here on the right-hand side. I'm going to have the patient tilt his head slightly to the left so I could have a clearer view. Great, I don't see anything. I'm going to start moving the bed up. I'm going to move it to about a 30-degree angle. Okay, I'm going to ask the patient, how are you breathing? He's going to state that it's fine. Now I'm going to look again at the jugular vein, okay, and it's great. There's no distension, which is wonderful. Next, I'm going to move on to a fully upright position. I'm going to ask the patient again, how are you breathing? He's breathing just fine. There's no difficulty breathing in either position. After I've done that, what I'm going to do is I'm actually going to start to palpate. So I'm going to palpate the chest. I'm going to palpate in all areas of the chest. I'm going to check for tenderness. Does it hurt at all? No. I'm going to check for any masses. Okay, I'm going to check to see if there's any crepitus or anything like that, which I don't feel, which is wonderful. I'm going to next palpate the coronary landmarks. So I'm going to start at the second intercostal space, and I'm going to check for any heaves or lifts. This is the aortic landmark. Now I'm going to move on to the left hand and second intercostal space. Again, checking for heaves and lifts. It's pulmonic, none, which is great. Now I'm going to move on to the third intercostal space, Erb's point, no heaves or lifts. Fourth intercostal space, tricuspid, no heaves or lifts. Fifth intercostal space, midclavicularly, again checking for heaves and lifts. There's none. This is the mitral, which is wonderful. Okay, after I've done that, I'm also going to palpate the back and the sides. Everything is clear. Everything is within normal limits for my patient. So after I've done that, what I'm gonna do next is I'm gonna auscultate. So I'm gonna listen. Actually, I'm not. What I'm gonna do is I'm gonna check symmetry. So I'm gonna put my fingers like this together, okay? And I'm gonna have the patient breathe. I'm gonna have him breathe in. As he breathes in or out, no, in. My fingers should be spreading apart equally. They spread apart equally, bilateral, and equal, bilateral, and symmetrical on both sides. Next, what I'm going to do is I'm going to listen. I'm going to listen to the lungs. So I'm going to start above the clavicle, move on to the other side, and using a ladder technique. I'm going to listen to all 12 points, and I'm going to listen for a full breath in and out. Okay. Great, there are no diminished sounds. They're clear, equal, no crackles, rails, or anything like that, which is wonderful. I don't know why I took my stethoscope off. I'm gonna listen to the heart now, okay? So using the same landmarks that I used before, I'm gonna listen to the heart, at the aortic, the pulmonic, the herbs, the tricuspid, and the mitral valve. I'm gonna listen to the mitral valve for a full minute, just so that I can get the full applicable pulse. After I've done that, what I'm gonna do is I'm gonna check all his pulses now. I'm gonna start from the top, working my way down. So I'm gonna start at the carotid. I'm gonna check both sides, but I'm not gonna do it together because, don't wanna cut off the circulation. So I'm checking bilaterally. Their force is equal at +2. It is at a rate of 20 beats per minute, and the rhythm is 20 beats, 80 beats per minute. Oh my God, my patient's dead. 80 beats per minute at a regular rhythm. Then I'm gonna move down. I'm gonna check bilaterally the brachial, the radial, the femoral. And I'm gonna come back to this, the tibial, and the dorsal. Now with the popliteal, I have to use both hands. So I'm gonna do one at a time. Check, check. All my pulses are equal. Force is +2. They're all regular rhythm. Excuse my stutter. And all 80 beats per minute. Yes. All right, great. After I've done that, I'm going to do cap refill on all 10 fingers and all 10 toes. Okay. The cap refill is under 2 seconds, so he has great circulation. While I'm at the fingers, what I'm gonna do is I'm also gonna check the nails. I'm gonna look to make sure that they're pink, they're not brittle, they're not cracked, there's no clubbing. Wonderful. What I'm gonna do now, I'm gonna move back to the abdomen. Okay, I'm gonna look at the abdomen. I'm inspecting. I'm inspecting for stretch marks, pulsations, scars, petechia. Okay, I don't see any of that. It's non-distended, which is great. I'm gonna look at the umbilicus. It's midline with the body, also great. After I've done that, I'm able to listen. So I'm gonna start at the lower right-hand quadrant, okay? I'm gonna listen until I hear bowel sounds, which could take up to 5 minutes. Starting here, moving my way up in a clockwise position, right upper, left lower. My patient's bowel sounds are normal. They're neither hypo or hyperactive, which is great. After I've done that, I'm gonna pulsate. So I'm gonna pulsate for any masses, any tenderness. Does any of this hurt? Doesn't hurt. It's great. I'm also gonna feel that the abdomen isn't rigid; it's soft, which is good. Then I'm gonna move down. I'm gonna look at the genitals. I'm gonna look to see that there is no skin breakdown. The color throughout the chest, including the chest, the abdomen, and the genitals, it's all equal. The pigmentation is equal throughout, and it's appropriate for my skin's ethnicity and race. I don't see any discharge. While I'm here, I'm also going to look at his output for both urine and fecal. So his urine is yellow, clear, and non-malodorous at a minimum of 30 milliliters per hour. Fabulous. His stool is brown, medium amount, and it's a type 4, which is normal, which is great. After I've done that, I'm going to move back to the extremities. So what I'm going to do is I'm actually going to feel the temperature of all the extremities, both the front and the back of them. I'm feeling for temperature, I'm feeling for any sweatiness, diaphoresis, I'm feeling for any excessive dryness. I'm looking to see where the hair is and if there's any sparseness or if the skin is really shiny. For my patient, the skin is not shiny, the hair distribution is appropriate for the gender of my patient. After I've done that, I'm now gonna palpate. I'm gonna palpate to see for any edema. I'm checking for edema. I'm checking the joints for any swelling, any tenderness, nothing like that. Good. Checking the joints, okay. Checking here. Edema, swelling, none of the sorts. Edema is not present. There's none. Fabulous. After I've done that, what I'm gonna have the patient do is I'm gonna have the patient grab onto my fingers and I'm gonna have him squeeze as hard as he can. I'm checking for his strength. It's bilaterally equal on both sides, okay? And then I'm gonna pull against him and he's gonna pull towards him. I'm also checking, strength with resistance. It's equal bilateral. I'm gonna move down to the feet, okay? So what I'm gonna have the patient do is I'm gonna have the patient press against my palm like it's a gas pedal with all his might. Great. Same on the other side. Then I'm gonna do the opposite. I'm gonna have him point his toes to his nose with resistance. He's able to do that just fine. His strength is equal bilaterally. After I've assessed that, what I'm going to do is I'm going to ask the patient if he uses any assistive devices, such as a walker, a cane, or a wheelchair. He does not. Great. I feel comfortable enough to ask him to get out of bed and stand, because we're going to check his gait and posture. So as the patient gets out of bed, I'm going to have him stand up, and I'm going to have him face towards me, turn to the side. I'm going to look at his posture. There's no kyphosis, there's no lordosis. His gait is equal, steady. There's no tremors, there's no tics, there's no spasticities, which is great. After he's done that, I'm going to have him put his feet together. I'm going to have him cross his arms. I'm going to check to see what his balance is like. After I've checked with his eyes open, I'm going to have him close his eyes, and I'm going to check for balance and anything like that. It's great. He's steady. He's balanced. After he's done that, I'm going to have him sit at the edge of the bed because we're going to do some range of motion exercises. So I'm going to have him start at the neck. I'm going to have him look down, look up, look side to side. I'm going to use resistance. Great. Then I'm going to move on to his upper extremities. So I'm going to have him start with pronation, supination, flexion, extension, circumduction, abduction, adduction. He's able to do it just fine. He has a great range of motion. I'm going to have him lay back down. After I have him laid back down, what I'm going to do is I'm going to make sure that he has everything that he needs within arm's reach. His call light is within arm's reach. I'm going to cover him back up. I'm going to make sure he's comfortable. He doesn't need anything. I'm going to put the safety rail back up, and I'm going to put the bed in the lowest possible position for my patient's safety. I'm going to ask if there's anything else that he needs before I go. He states that there isn't. So I tell him I'll be back within a reasonable time, and I have completed my full assessment.